Hello, Dr. David Bushore, board-certified dermatologist here at Balcones Dermatology Aesthetics. We're in part 2 of a series of 3 talking about the upper face. We'll talk about the eyebrow now. There's things that we have to think about when considering the eyebrow because not only is it just the eyebrow, but it's the areas around the eyebrow that play a role in aging. So we can have aging. I'll show you in this picture right here. What happens as we age, there's loss of bone that happens as eye socket expands. The other thing is there's loss of volume and bone right here within the forehead itself, which we just talked about in the first series. So what happens with that, we have to pay attention, is that as there's loss here, that means that frontalis muscle that's pulling that eyebrow up can actually pull it farther. So we can sometimes notice that people's eyebrows go higher. So we got to be real careful that we maintain the right ratio here in terms of the right angle for the brow. So we can change things with Botox that can help relax the muscles of the forehead or underneath. This is called the orbicularis oculi muscle, and that can help relax that, and if we need to lift it or lower it, we can do it hitting Botox on either side of this brow. Fillers can also be used to help hide that hollowing effect that happens as we age and as the bone recedes. For women, we want to have a 25-30 degree angle coming off this medial brow up to the peak, and then it comes down a little bit at the edge. For men, it's more of a 10 to 12 degree angle. It's more flat, and to make sure that we got the right area for the peak, we can make sure that we measure with the calipers, and these are phi calipers. So we can measure the distance between the medial canthi, make sure that the phi of that is where the peak of that brow should be. And so we can make sure we get everything exactly right. That's it for part 2. We'll see you for part 3 about temples.